I just kind of want to, give you my little background and how I got involved in sleep apnea, because it's a very interesting story. So I had been practicing already, probably about 15 years or so. And I had a patient from New York City that used to come in and commute with me to New York City. And they came in and they were going on vacation, and they came in with an oral appliance back then. So this is over 15, maybe even close to 20 years ago. And they showed me this appliance and they said, hey, look, I'm going on vacation. My dentist in New York who made this for me, is not around. Could you take a look at it, and just make sure it's okay? And of course, I looked at this and I had absolutely no idea what I was looking at. So I said to them, of course, I'll take a look at this. And then I said, I need to learn about sleep apnea, what these appliances are, and learn all about that.
So really an accidental
yes,
introduction to sleep medicine and OSA, obstructive sleep apnea. Warren, when I think of your practice, first of all, you have a general dental practice, but I think of it as, in addition to everyday general dentistry, I think of it as kind of focusing on three particular areas. In no particular order, TMD and TMJ disorder, helping patients with TMD and TMJ disorders. I also think of your skills as a cosmetic dentist. You're highly trained, highly skilled as a cosmetic dentist. And then the third area that I think of is the part of your practice that is committed to helping people with obstructive sleep apnea. And that's really the direction I want to take this interview on. So I love your initial foray into OSA was really a happy accident, right?
Yes. So it gets even better, Gary, to let you know. So I say to myself, all right, I need to learn this. I need CE. I take a lot of CE anyway, so I might as well add OSA, as part of it. So I go to the very first course, which I think was out in Chicago. Somebody was lecturing. I don't remember who the speaker was, but all I remember is he put up one of these slides. It was almost one of the first slides after the introduction. And it had all these bullet points, maybe about 5 of them. And it said, if you typically have OSA, you may have these comorbidities. And it had, high blood pressure and, all the different things that would go. And I looked at that slide and I almost fell off the chair because I clearly had 4 out of the 5 of those comorbidities. And I said, you know what? I bet I have OSA. And this is something that I never realized, I never even thought about. And most people that have OSA, I don't know that they realize they have OSA. It's kind of like putting the frog in the water and heating them up. And, you just think, well, I'm tired because of life. I'm tired because of the kids. I'm tired because of school. And you keep making excuses. And then you may realize one day that, hey, maybe there's really something. And this was OSA. And that was my aha moment into.
So you went obviously, as wearing your professional cap,
yes,
as a dentist to learn more about OSA, so you could provide that type of treatment to your patients. But little did you know that you were going to benefit as a patient.
That's exactly correct.
Wow.
So then of course, I realized that, well, now I have this opportunity to try to treat, the OSA that I believe I have. So of course I went and I got a sleep study. I started meeting, my physician colleagues, and I started meeting the sleep centers, which there were many more than there are today for all kinds of reasons. But and I got a sleep study, and in sleep apnea, one of the criteria that we measure for severity is how many times you stop breathing for 10 seconds or more. So if you took out how many times you stop breathing for 10 seconds or more, you divide it by the time that you're sleeping, you get this magic AHI index, which seems to be right now the number that we're using to, quantify severity. So we know that if you have, under 5 per hour, then you would be considered within normal limits. 5 to 15 would bring you to mild. 15 to 30 would bring you to moderate, and over 30 would bring you to severe. So my number was 25. So I was clearly had moderate OSA.
Moderate leaning to severe.
Yeah, I didn't even know about it. So, I would wake up and my throat would be sore. My wife would complain about snoring, and I would wake up tired, and she would want to go running in the morning like you do at the crack of dawn. And I would say, no, I want to go back to sleep. And then I realized that, no, I had OSA. So this wasn't really a journey to treat my own OSA. And then of course, once I treated my own OSA, that was a natural, a natural outreach to help others to treat theirs. And that's really where it comes from.